Thank you very much, Richard. So we now have two panelists who are going to provide some thoughts on the presentations. The first is Balbinda Gill, who is a local paediatrician who I know sees a great number of children and youth with ASD.
Thank you. So I'm a pediatrician. I work out of Richmond Hospital and have a private practice too. I've been seeing children with autism for almost 20 years now. And in the early days, the biggest struggle used to be diagnosis. We used to spend a lot of time trying to make a diagnosis of a child. Hours and hours were spent trying to gather information from the parents, educators, assessing the child, and coming up with a diagnosis. After a diagnosis is made, things become very complex, because then we need to find out what is the next step, where should we go from here. And the next step really to go is based on how are the parents coping, how are they managing. The parents get a sense of what this diagnosis means. The parents also get a sense of what treatment can be provided. They're told that there is money that can be used towards providing support and treatment for the child. But what they're really not able to get is to kind of have someone kind of sit with them and find them some support, give them some understanding of where they are, for them to be able to just understand the whole issue of what has just happened to them, that how is the child going to be affected by this, how are they themselves going to be affected by this, what type of services do they need, who can help them with those services. You know, we give them out long lists of behavior consultants and speech pathologists and occupational therapists, physiotherapists lists, but no one really tells them, go and see this person or that person. So, you know, we are diagnosing the child, we are barely making a sense of this child's difficulty that the parents understand. And then after that, the child is struggling with their autism, but more importantly, they're struggling because we are not recognizing that a lot of children with autism also have mental illnesses. And those mental illnesses just do not get identified at many different levels. The child may be able to tell us some of that if they are high functioning enough. The parents may have some ability to do that. The professionals are the ones who really have to start picking this and finding support for the child. I really feel physicians, the general practitioners, have a big role in keeping the families connected with them, to be present for them, to be able to guide them. And I think when we talk about recognizing mental health conditions, we really have to get the family physicians involved, because those are people that the child and the family are going to be connected with for a long time. The other issue that I want to quickly talk about is I work at the Child and Youth Mental Health team here in Vancouver. I've done that for 15, 20 years. We have really had struggles trying to engage the child and youth teams to provide support for children who have autism. They usually feel that the funding that the government gives to children should take care of the counseling as well, but the funding does not do that. And it is important for us to find a way of having child and youth mental health teams engage with us and try to understand our children and try to find ways of supporting them. It will require more education. It will require a lot more money on the part of the government to find them that type of education. The counseling is difficult, it is time consuming, and people do not feel very comfortable or confident when they have to deal with a child who may be nonverbal. Also, they may not understand that the results will come at a very slow pace. They're not going to happen as fast as they may expect with their other children. So those are some of the issues I wanted to bring up while we talk about recognizing mental health issues.
Thank you very much for those excellent additional points. Grace, don't run away. So our next speaker is Professor Grace Iorochi, who's a developmental psychologist specializing in ASD at Simon Fraser University.
Thank you. So I'm both a researcher and a practicing psychologist here in BC. So I'm hoping to just give you a few sort of insights that I've had through my both professional experience and some research that we've done in our lab. So one of the things that I've found first in terms of just practical tips on the clinical work that I do, asking people with autism open-ended questions doesn't work very well. So I've, over the years, decided that even though some of them are very verbal and articulate, that it's much more helpful to provide sort of short, closed kinds of questions, things that you might get on a questionnaire. But I might intersperse that with some interview questions. So I might give them or read out a questionnaire and have them rate a response like a Likert scale, not at all to very much. But then if they say very much, I might sort of ask them a little bit more about that. But always very sort of close-ended, because if I ask a sort of open-ended question, often I get sort of a blank look or don't get very much, because often people with autism do have trouble communicating, even though they have very good verbal skills in many cases. So that's just a little sort of clinical insight that I've had. The other thing is we've done a couple of studies recently that are relevant to what we're talking about today. One with collaborators at the Children's Hospital in the neuropsychiatry clinic. And so there they see children with autism who have anxiety disorders, but they also see other children who don't have autism and have anxiety disorders. And so we've looked at some of the data there, and that shows us that actually children with autism might have anxiety symptoms that are kind of interacting with their autism symptoms. So things like sensory sensitivities that might provoke certain phobias or certain fears. And so often you might get a sort of combination of the autism symptoms as well as anxiety symptoms. And finally, one other study that we did recently showed a very high association between mental health, things like anxiety and depression symptoms, and also poor social competence ratings. So those two things were very highly associated, meaning that it's possible that, well, one could be influencing the other, but that, the higher the mental health symptoms, the more poorly the social competence. And so those are some things that you might want to keep in mind as you think about mental health and ASD.